Good afternoon, everybody. I hope you enjoyed the lobster rolls and the conversation. We try every year to do some new things and experiment with ways to deliver content that's fresh and interesting. And the next group of presentations is truly a new innovative thing for us in a couple of dimensions. The first is this long block of content by one group of folks on one theme. It's about 2 hours, so strap on your safety belts. You're going to be really both entertained and learn a lot in the next couple of hours. The second is the theme, and the theme is design. And this has been a personal peeve of mine over the last number of years. I would say the vast majority, I hesitate to use superlatives, the vast majority of healthcare applications are poorly designed, both for healthcare providers and for our patients, and even for the consumer ones that I see. I don't know why it is. People don't seem to be putting the attention into design in healthcare that other aspects of the industry are. And this leads to confusion, people's thinking, for instance, that for some reason we can reproduce what Snapchat has done for messaging and make a $19 billion company overnight in healthcare. Well, there's a lot of reasons we might not be able to do that, but certainly among them is the fact that we don't design stuff well. So we have good friends, a local agency, MadPow. Many of you may know MadPow. They've been good friends of ours for years. They've been part of this event in one way or another over the years. And this year we decided to give them a 2-hour slot. And they're going to do some really impressive and fun things centered around improving design, user-centric design. And I'm going to introduce their team, but their first person that's coming out is, oh, I blanked. Okay, the MadPow team. I'm going to just leave it at that. Take care.
Hi there. Hi, everybody. I hope you had a fantastic lunch. My name is Robin Zander, and I'm actually going to be your MC for the afternoon. And what this means is a number of different things. We have 3 incredible presentations, but we've decided to make it more of an engaging experience rather than just sitting in your seats. We're going to have some activities that actually take you maybe even a little bit outside your comfort zone, because change can be difficult, and we believe that taking those little steps towards changing is really important. So as you came in, raise your hand if you did not get a booklet, our little Design for Change booklet. It should have a little sticker packet in it. So raise your hand if you did not get one of those booklets. And please pull out your booklet. You'll see on the left-hand side, it has empathy, collaboration, and motivation listed. And what I want you to do is just off the cuff, give yourself a rating in each of those categories. You'll also notice in the booklet that there's a character and then the stickers. We're going to come back to that later. But the goal throughout this afternoon is to unlock your skills at collaboration, empathy, and motivation, and give yourself little prizes, give yourself rewards in the form of those stickers onto that character. So mark down, just off the cuff, empathy, collaboration, and motivation, how you think you rate in all of those skills. And that's going to change throughout the course of these presentations. So again, we have 3 different speakers, and then at the end we have a number of interactive games where you get to continue to practice and refine your skills. Our first presenter this afternoon is Amy Cueva. Amy is the co-founder of the design agency MadPow. She's also the Chief Experience Officer. She runs the design track at the annual conference, Health Experience Refactored. And she's here today to present on empathy. I give you Amy Cueva.
Can I have my slides? Hi, everyone. I'm Amy Cueva, one of the founders of MadPow and Chief Experience Officer. And as Robin mentioned, I'm also the chair of a conference called HX Refactored. And we founded that conference 6 years ago to explore how human-centered design and technology can help us to improve health experiences. The next conference is April 5th and 6th, right here in Boston. At MadPow, I oversee our health practice, where we're working with organizations from across the health spectrum, from payers to providers, government to nonprofit, health tech to pharma companies. And we're working with these organizations to improve the quality of interaction that they have with the people they serve, both inside and outside of their organizations. We're bringing human-centered design to these companies, and they're clamoring for it. They know it's needed. And in the process of working with such diverse organizations, it's given us a unique perspective into what works, what doesn't, what are the unmet needs, the gaps, the pain points, and the opportunities. So I'm here with you today to discuss empathy. I think that empathy-inspired design can help guide us in our mission to improve health experiences and guide us toward making the change necessary to bring those experiences to life. The world hates change, yet it's the only thing that's brought progress. As Dr. Joe mentioned, change is the topic for this section of the agenda. We're going to be discussing how we can design for change. And we know that change is necessary. We desire change because we see how oftentimes painful the system can be in terms of how the people within it experience it. And we feel it. But we also feel the hope associated with the notion that there must be a better way. And I believe that design can provide us with a creative and human-centered pathway to inspire, to motivate, and to guide change, helping us to improve the experience of health for the populations that we serve. So in this section, I'm going to be talking about empathy-inspired design and advocating for the inclusion of the people who will be affected by the decisions we make and the solutions we create in the process of creating them and making them. That is the backbone of human-centered design. And then we're going to be going into motivational design and designing for behavior change. Moving beyond manipulation and into empowerment. One of my colleagues, Dustin DiTomaso, he heads up our behavior change practice at MadPow, and he's going to be diving deep into key considerations for designing for behavior change so that we can have lasting and effective behavior change. And then we're going to move into how to foster cultures of empathy, collaboration, and creativity. Adam Connor, the head of our organizational design practice at MadPow, is going to be sharing some insights with you on that topic. But starting with empathy, I believe that empathy can inspire our direction as individuals, can guide our businesses toward achieving greater results, and I also believe it can guide us toward a positive human impact. I'll start out by asking you a question. How many of you have been seriously affected by a health situation, either your own or through a loved one? So many of us, it's part of the human experience. The wounded healer concept occurred to me when I was coming to grips with adversity in my personal life, facing the addiction of a loved one, having my daughter recently diagnosed with an autoimmune disease, going through a divorce, and coping with my own depression and anxiety. All of these experiences formed my perspective. And sharing my patient's story through joining Regina Holliday's Walking Gallery, giving a soul-bearing presentation at the XX in Health retreat, and hearing patient stories of so many in industry opened my eyes and firmed up this concept. So I did a little bit of research. And I found that Carl Jung actually coined this term, wounded healer, and he said, a good half of every treatment that probes it all deeply consists in the doctor's examining himself. It is his own hurt that gives a measure of his power to heal. And we know hurt. We know what it's like to experience pain, confusion, fear, and anxiety. And that gives us a greater capacity to understand, to empathize with the pain, confusion, fear, and anxiety of another. Our empathy, that awakening has created a burning desire within us to heal the system. so that nobody else will have to experience what we experienced. And hopefully, in the process of healing the system, we'll experience a little healing ourselves. Our empathy helps us find our purpose. It fuels our passion, and it forms our drive. And we need that drive, because people will tell us we're wrong. We have to be ready for that. You may have heard the saying, "He who hears not the music thinks the dancer is mad." If you are a lone voice, it is even more important for you to be heard. We can embrace our unique perspective, and with the courage of our conviction, seek out those who share it. I think we need to get comfortable being uncomfortable, because change is difficult, especially when you're the one driving it. But we do what we do because we must. There's no other response. Insist upon pretense and you'll have it. Insist upon mediocrity and it's yours. Insist upon beauty and you will find it. Insist upon learning and you will learn. Insist upon living with great passion and you will see differently. I believe that adversity makes us stronger, both personally and professionally. There's certainly no shortage of adversity in health. Medical costs are still the #1 reason for bankruptcy. We're #1 in cost in the world and 17th in outcomes, and there are so many complexities to contend with. Corporations with competing perspectives, new legislation, FDA regulations, HIPAA, and institutional residue. Sometimes it can seem like there are few easy or clear solutions. But I believe the adversity we've experienced makes us even more capable and more equipped to drive forward the change that needs to happen. What's good for the people we serve ultimately is good for the business. Human-centered design opens up a pathway. Empathy-inspired design opens up a pathway to make our organizations more human-focused so they can deliver better results to the people they serve and also see results in the bottom line. In the Harvard Business Review, in the article, "Corporate Empathy is Not an Oxymoron," Belinda Palmer points out, there's nothing soft about it. Empathy is a hard skill that should be required from the boardroom to the shop floor. Organizations are waking up to the value of empathy, and they're also waking up to the value of design. The Design Management Institute scorecarded publicly traded companies in terms of their enacted commitment to design, and those who were fully committed outperformed those who were not by 228% on the stock market. The Design ROI Research Project looked at this as well. And they found that there was an overwhelming correlation between a focus on design and competitiveness. We're looking at the value of design and what we do. We can explore the inverse. We can think about, what are the costs associated with bad design? Jonathan Chariot, author of the soon-to-be-released book called Tragic Design, was inspired to write that book when he was devastated upon hearing the story of a little girl with cancer who died because the nurses treating her were unable to clearly view the treatment regimen in the EMR. Confusion in the interface led to that. So clearly, there are good outcomes to be had associated with positive design and potentially disastrous outcomes associated with bad design. Corporations who focus on design will continue to win in the marketplace. Here's one simple example, a responsive website redesign. It delivered clear business results. It also reduced frustration for users. And we love this. We love site redesigns, mobile apps, and all of that. But it's not just about site redesigns. There's a maturation that occurs as organizations start to embrace and understand design. It goes from hitting it with the pretty stick to valuing design as an essential discipline and critical success factor. And then companies move into fostering an empathy-driven culture where the customer is the focus, and that thinking is woven into business practice. And we need that focus on people. Because right now, people are left to navigate a very disconnected ecosystem on their own. The health system functions, but it doesn't come as close to whole health as we would hope possible, considering our human capacity to care, to connect, and to innovate. But I believe that we can move beyond the transactional. We can build trust with the people we serve. We can start to become their partner in health, tracing their path through the ecosystem, looking out for pain points, unmet needs, gaps, and opportunities, and also looking for organizations who have shared objectives. We know that silos exist both inside and outside of our organizations, but we can explore new forms of collaboration that break down walls. I believe that these new forms of collaboration will lead to unprecedented innovation and unimaginable results, that we can gather together around shared objectives and design an ecosystem of care. It was that spirit of collaboration that led us to partner with the CDC, JSI, and nonprofit AIDS services organizations, as well as HIV patients themselves, to understand what truly drives non-adherence in HIV. And what we found inspired us to create a solution that aligns with intrinsic motivation, involves social support, and ties improved lab results with adherence so that people can see the benefit of their adherence efforts. This Cindy Gallup quote sums it up pretty well. Shared values plus shared action equals shared profit, both financial and social. Empathy and human-centered design aren't just idealism. They're good business. And I think, in fact, they will deliver societal impact as well. So let's explore that. It is an experience economy. Other industries are waking up to this fact. In financial services, for example, it's not just about the products, the transactions, the services, the self-service enablement anymore. It's about the relationship that people have with these companies and the perceived benefits of that relationship. Imagine if a national bank could help people save 5% more. That would have an impact for the business. It would also have an impact for the individuals, and it would impact society as well. When society wins, business wins. I believe that purpose will lead to profit. And I'm not alone. Roy Spence wrote the book, It's Not What You Sell, But What You Stand For. And he says that great companies have an authentic sense of purpose, a definitive statement about the difference they're trying to make in this world, and a workplace with the energy and vitality to bring that purpose to life. As organizations operationalize their purpose, we will see corporate social responsibility and customer experience disciplines converge. I'm so excited about this concept. I think we're going to see this more and more moving forward. And as we walk into our planning meetings, where we're trying to figure out, okay, what's going to drive our innovation in the future? This may be a concept we want to grab onto. Because the consumers we're dealing with now are different. They are more and more aware of how the organizations they do business with impact society. And that knowledge is shaping the decisions they make around who to do business with. It's not profit. Making a profit isn't enough anymore. And easier said than done, right? But we're starting to see this happen. Insurance companies, for example, are moving beyond being a partner in adjudication with their members and trying to help them achieve better health. Pharmaceutical companies are looking at how do we leverage digital to help people heal instead of just drug therapies. So we're going to start to see this more and more. In the exploration of ethics and impact and unintended consequences, designers at MadPow, two fantastic designers, Sierra Taylor and Sam Dempsey, you may see them with superhero capes around here, they put together the Hippocratic Oath for designers. We're exploring the impact that we have in the system. Now, this was crowdsourced, created collaboratively with other designers in health industry-wide. And Dustin, who will be up in a bit discussing behavior change, will be also diving into the ethics of behavior change. So we talked about the importance of empathy and how it can guide our efforts. Now I'd like to share with you some tips on how you can integrate empathy-inspired design into what you do. We can become students of the problem, inclusive in our approach. As we get outside of the four walls of our organization and get face time with the people we serve, we will get the rich insights that will guide our efforts moving forward. We'll come to have empathy for the people we serve and understand what will truly engage, guide, comfort, support. And we can weave that thinking into the solutions that we're working on. And we can involve stakeholders in that process. We need to all get out of our offices and meeting rooms. Humana did an excellent job at this. They paired C-suite executives with an ethnographer, and for 1 day per month, they spent time with Medicare members in their homes. And they would also talk to that same member, for a half hour per week. Through that activity, they came to truly understand the struggles of their members, not just with their minds, but with their hearts. And then they said, oh my goodness, we need to fix this. We need to make things better for these people. And they funded an 80-person consumer experience team dedicated to experiential innovation. We'll continue to see companies that do this receive the rich insights that will guide experiential innovation for years to come. Clayton Christensen says that you need to have a good theory, and that's going to guide your disruptive innovation efforts. He also says that it's in understanding the people we serve in the present that we can construct a theory about the future. And the best way to understand the people we serve is to be right there with them, observing them in their native habitat, so to speak. Through research, we can come to understand emotion. Emotion will show us where to focus, where we're doing well, and where we need to improve. Emotion's important. The emotion of the people we serve, as it will affect the trajectory of their path forward, but also our emotion. We need to remember to allow ourselves to feel so that we can move beyond cognitive understanding into visceral knowing, that gut feeling that we get. It inspires our curiosity, it powers our imagination, it enhances our wisdom, and it gives us the motivation to keep going. And we can consider the full range of emotion that people are bringing to the table. It's not all the happy path. Sarah says, if we're able to consider users at their worst, and if we're able to make experiences feel good for people at their most vulnerable and most difficult moments, then we can make them work for everybody. People in these situations aren't exception cases. They're very important people that need to be considered. So you may have seen personas like this one. Personas can help us put ourselves in the shoes of the customer so that we can design for them. And personas aren't going to just contain demographic information. They're also going to contain behavioral, psychographic, and emotional information. My fonts are messed up. I apologize for that. But we need to go beyond personas as well and look at the journey. We can use journey maps to understand the current state journey and to imagine what the future state journey could be like. We can look at the interplay of emotion with the health journey, looking for spikes in emotion as they may be indicative of an at-risk individual or an unmet need. We considered emotion when we were designing a decision support tool for pregnant women. A lack of knowledge can lead to a lack of confidence and an increase in anxiety. And that's important to factor into the design of a decision support tool. We can formulate, you may have seen, you're aware of Maslow's hierarchy of needs. We can come up with a hierarchy of needs based on research insights with our customers. This is one that I came up with for health. You could use this, or you could come up with your own. But starting at the bottom, foundationally, building a trustworthy relationship, a trustworthy experience. And an example of this is if I'm able to get the information and the utility that I need out of an experience when I need it, at every point, every touch point in the ecosystem, then there's trust there. If that experience was easy and it didn't give me too much frustration and I could figure it out, then that's ease. Or was the experience kind? Did I feel like I was considered or treated well through the experience, treated like a human? And then meaning. Was the experience meaningful? Did it help me achieve what I'm looking for in life? So not just using the product or the site properly, but actually getting a benefit in my life. And then there's, oh, that's really cool. This was cool. I like it. I'm going to tell my friends about it. Oftentimes in health, we have shiny object syndrome, where we're looking to deliver on the very cool without first delivering on trust, ease, kindness, meaning. And we can move beyond digital as well and look at the whole ecosystem of interaction. Who are the folks involved in the process? The family? How do we facilitate patient-doctor communication? How do we leverage digital to improve those communications as opposed to get in the way of those communications? How do we educate the family and involve them in supporting the patient as they make the changes that they need to make to change their lives and improve their health? We can also audit every touch point in the ecosystem, looking at how the personas that we're picking, we're designing for, and that are guiding us, how will they experience that touch point? And evaluate it against the hierarchy of needs. We can also evaluate current state and future state experiences against the purpose beyond profit that we discussed before. The experience that people have is a byproduct of how we're organized internally to deliver it. If we're a mess on the inside, the resulting experience is going to be a mess as well. It's not enough to envision a better experience. The idea isn't enough. We need to actually bring that experience to market. One way to start to change things from an organizational perspective is through training, though that's not the only way, and Adam will be sharing with you other tips on how to do this. But training can help. Telefonica Germany launched an enterprise-wide empathy training initiative and saw a 6% increase in customer satisfaction in just 6 months. And we're seeing many corporations and health systems clamoring for training in empathy, human-centered design, design thinking, and collaborative process. We conducted a training activity with a large health system, training 60 people in these things and training them to be trainers so that they could then go out in the organization and spread the word. So Belinda points out as well that empathy can be measured, but that empathy is often dismissed by serious people who would prefer the concrete virtues of rational analysis. Rational analysis is great, but I would argue that we get rich insights that will fuel experiential innovation and disruptive innovation through empathy and human-centered design. One of the organizations that we work with will evaluate the business decisions they're making in terms of what kind of impact is it going to have on the customer experience, positive, neutral, or negative. And if the perceived impact is negative, there's an escalation path for that so that they can remedy the situation. I believe, in closing, that empathy will inspire our direction as individuals, will fuel business innovation, and can help us to deliver a positive human impact. I want to thank you so much for exploring empathy here with me today. I hope that some of this stuff has helped you out, and I can't wait to see what you do. Thank you so much.